Our company, the name is Ewa Medical. We are in the north of Italy. I don't know if you know Italy, but we are in Rimini, in the northeast, 1 hour close to Bologna. We were born in 2011, and for many years, for 7 years, we invest in time only research. So we produce a lot of scientific evidences, all randomized and double-blind study. And all our studies are already published on PubMed. So we are solid, our claim is proven science. And we focus especially on regenerative medicine. We are really effective to accelerate the tissue repair on soft tissue and bone tissue. On soft tissue, we have an average of effectiveness around 75 to 80%. On bone, we reach an effectiveness around 90%, without any type of side effects. The device that I like to introduce to yourself today is really a cutting-edge technology, because in the world there is no other device like this. I don't want to say that this is the best, because it's not our approach, but for sure it's unique, and today I'll show you why. Limfa is a cell stimulator, because by 29 different sequences of complexes, variable and pulsed magnetic fields that we patented, we are able to open and close selectively specific ion channels. The technology is 100% Italian, and all the study that we made, we conducted at the leading Italian university. University of Rome, University of Verona, University of Milan, University of Florence. We have many studies that are already on PubMed. We have on fibromyalgia, on carpal tunnel, osteoarthritis, osteoporosis, temporomandibular joint, and bone healing delay. All our evidence are available to be downloaded for free from our website, limfa.it, but at the end of the presentation, Dave and Chrissy can forward to you the link if you want to download this evidence. In Italy, there are more than 350 clinics that already are using our device. We have in all parts of Italy, in the north, in the south, and center. And during the last 2 years, we started to sell abroad of Italy. At the moment, we are present in 50 countries, and we have 8 distributors in the world. We started at the beginning in East Europe, because in East Europe there is a great culture for magnetic fields. And we have distributors in the Czech Republic, Slovakia, Romania, Ireland, UK, and recently we started in Middle East, Saudi Arabia, Qatar, and China. Finally, in May 2025, we got the FDA for US market. In sport, Limfa is really effective because we are able to cover specific applications like bone edema, stress fracture, joint articular pain, where really there are no other solution. And for this reason, the top club, football club for the soccer is football in Europe. The top club in Europe already are using the device. The first that has been Limfa has been Real Madrid in 2019. The second has been Manchester City. You know, Manchester City and Real Madrid maybe are the most important club in the world. And in Italy, we work with Juventus, Lazio, Inter Milan, AC Milan, and Roma. We are helping many important professional players, especially in tennis. Here we have Sasha Zverev. He is at the moment number 3 in the world. And we helped a lot, especially after Wimbledon 2024, because during the tournament he had a bad injury at his knee. And someone told to him that there was a very effective and innovative Italian technology that was able to accelerate the healing process and to reduce the healing process over 50% time. He contacted us. I visited him in his home. He lives in Monte Carlo, in France. And he made Limfa for 10 days with twice treatment per day, one in the morning when we treated the inflammation, edema, and pain, and one in the late evening to treat the bone regeneration. In only 10 days, he was able to come back to the field, and he participated to the tournament in Hamburg, in Germany, and he made a good job because he lost in final. On the right, sorry, we have another athlete that in Italy, she's very famous because she's one of the first 10 tennis players in the world. Her name is Jasmine Paolini, and she used to travel always with Limfa in her luggage. What it is for? This point is very important because Limfa is really different from all other devices because our goal is not to work on pain. We don't work on the symptoms, on the effect. We work on what produces the symptoms. So, of course, we reduce the pain, but because at base we are able to reduce what produces the pain: inflammation, problem at tissue, edema, and other things. So it means that this device is not for pain relief, but is for regeneration. What it means? That you have to follow the protocols. This is not therapy that you make one time and you obtain results. Yes, you can have, but especially on chronic pathologies, on tissue repair, you have to follow a protocol of at least 15 sessions, and to have some results, you have to wait 6, 7, 8 treatments before it is impossible to receive, and it's important that you know this approach. For chronic pathologies, specialists can happen that, especially after the first or the second session, the pain can increase a little. Don't worry, this is right. It's something that shows that our stimulation produces a reaction. After 2-3 treatments, that goes away. This device is really effective on all osteoarticular pathologies, back pain, shoulder, knee, ankle, both in acute phase and in chronic phase. In acute phase, we can work immediately after trauma, when there is swelling, when there is inflammation, immediately after surgery. You don't need to take pharmaceutical drugs or ice. With this approach, we speed up the healing process, and we allow to physiotherapists to start before with manual therapy, because we normalize very fast the situation. We are effective, for a moment, on rheumatology, traumatology, and fibromyalgia, and on all tissue repair, bone and soft tissue. Soft tissue, it means muscles, tendon, ligament, and cartilage. Which is the principle? We start from what we know by research, that cells are capable to speak with each other and to send with each other specific self-repairing messages. So what we made has been developed 29 different sequences that are able to open and close selectively specific ion channels, because we want to modify the electrochemical balance at cell membrane level. So we work at ion levels, and the goal is to open and close specific ions, compare which is the goal. If we want to accelerate the bone repair, for example, we have to concentrate our efforts on ion calcium, because ion calcium are connected with bone regeneration. This slide explains what happens to the cells when cells is healthy, when there is a right electrochemical balance in terms of higher polarity order. In the middle, you have the cells when becomes sick, and you can see that there is an unbalancing in terms of polarity order. What we make is to reset this right polarity order. After this, we start to communicate with cells, because our goal is to communicate with cells. We don't produce energy. All other therapies produce energy, so the approach of other physical therapies is mechanical. Our goal is to help cells to self-repair themselves faster. How it works? If the goal is to communicate with cells, we have to respect specific parameters, because in terms of frequency and intensity, cells use to speak with each other very weak and super weak magnetic fields. Consider that we work in terms of hertz, in terms of frequency under 80 hertz, in terms of intensity under 134 microtesla. 1 Gauss is 1000 Tesla. We work under 100,000.
And if I may add, the pure wave mats, for example, are approximately 1 Gauss in power. So the Limfa uses 1/10 to 1/100th of the power of the mats, because that is the same range that cells use to communicate.
This is very important, because the effectiveness of Limfa comes from not the point that we use very weak and super weak magnetic fields, because many other therapies use low magnetic fields. But we use this approach because by this approach we have to create a connection with cells. After that we made a connection, we start to communicate with them, and we send specific self-repairing messages that guide them to self-repair themselves faster. This is a frame of our sequences, when you can see that the signal is always different in terms of frequency, intensity, length, shape, and polarity. Our program lasts from 20 to 60 minutes, and the best indication is to repeat them 2 or 3 times per week. The point is that there is no one device in the world that can say to us in advance which are the best sequences for me or for her. But what we know is that if we play off all the program, in 75 to 80% of the cases for soft tissue, and in 90% of the case for bone, we will find at the beginning or at the end of the program the right sequences for you. So the point is that you can't interrupt, because maybe if the sequence is right where at the beginning is okay, but if we're at the end, if I interrupt the program, I have to restart. The device is completely automatic, no needed operator, and this is very important because we can standardize the result. All starts from the diagnosis. If the diagnosis is clear, is right, we have a specific solution in terms of manual of protocol. This device can work with true clothing, so you don't need it to undress. There is no problem in terms of privacy. We work on surgical plates, implants, and cast too. So if we have to work on fracture, we can work on cast too. Inside of the device are pre-installed 7 automatic programs, because from the sequences we developed automatic programs. These programs you could compare like pharmaceutical drugs, because to produce pharmaceutical drugs you start from the ingredients. In our cases, our ingredients are our sequences. By the sequences we develop the program. The programs that at the moment are already on the device are analgesic, anti-edema, anti-inflammatory, muscle relaxant, neuromuscular repair, bone repair, and connective tissue repair. But another most important point is that pre-installing the device, there is a manner of therapeutic protocol, because during the last 15 years we developed for every different pathologies that we are able to cover specific indication of use in terms of which program to use, for how many sessions, and the frequency that you have to follow for every week. This is very important because it means that we validated not only the effectiveness but the therapy. And to have result you have to follow the therapy. Here we have an index with many different pathologies like muscle lumbosciatalgia, back pain, osteopenia, osteoporosis, shoulder frozen, carpal tunnel, and other. And for every different pathologies, we developed a specific protocol. In this case, for example, for osteoporosis, we use the emitter, because the emitter, this device can work in 2 different ways. Inside, there are 2 channels. So it's like if you have 2 devices inside 1 device. With these 2 channels, you can treat at the same time 2 parts on the same patient, like in this case, hip and shoulder, or you can treat 2 different patients with different problems. You can treat shoulder for bone and hip for, inflammation. To work, we use 2 different tools. An emitter, that is a mobile phone, that produces a closed loop field with 18 centimeters, 7 inches of diameter. All that we put inside that range, we treat with the device. If you have a problem, 1 inch, 2 inch, 3 inch inside, that's no problem, because with that range we cover that area. So the emitter is really concentrated, and when you have to work on specific joints, and you know that with the approach of OsteoStrong, you approach to total body. That is right, because it's an umbrella, but when you have to work on specific joints, with this device really you can do very well. And to work on joints, so it's better to use a emitter. When you have to work on total body, systemic pathologies like fibromyalgia, osteopenia, rheumatoid arthritis, or DOMS for athletes, we use a MET. The difference from the emitter is that the MET is less concentrated but cover all the body. We have other programs for arthrosis, for bone arthrosis, when we describe which program to use, how many sessions, and the frequency that you have to follow. rheumatoid arthritis, we use the MET. Now we have some studies that I don't want to go too much in depth, but I want to show you some studies that are important for us. This is a study that we made on osteoporosis, a pilot study at University of Ancona, and after only 6 months, we reach plus 17.4 in terms of T-score, 3.2 in terms of BND, the bone density, 3% in terms of type S. Type S is a quality index because it shows the flexibility of the bone. And you know that by pharmaceutical drugs, you reduce the flexibility.
This is like the fragility score on your REMS, bone quality.
The bone quality. These results that we reached after only 6 months. Usually, in literature, with pharmaceutical drugs with biphosphonate, you reach after 1 year and a half. With the difference that we are faster and we don't produce any type of side effects. So it could be that this device for osteoporosis, for example, could be the first solution for all people that don't want to take drugs or can't take drugs. But if you are already taking drugs, this is a therapy that you can integrate with drugs with the prospect to reduce the quantity of the drugs. Another important application, could be to work on osteopenia, because especially women after menopause, they have a big problem instead for bone degeneration in the first 2 years after menopause, and with this device you really can make a prevention. For the protocol of osteoporosis, we use the emitter, and we put the emitter before on the idiofemur and after on the back, because are the part of the body where the risk of fracture is higher. So the program, the session for osteoporosis lasts 27 minutes before on the idiofemur and 27 minutes in the same session on the back. So lasts 54 minutes. For osteopenia, we use the MET. We use the same program, the bone repair program, but it lasts only 27 minutes. Both protocols, osteoporosis and osteopenia, are based on only 12 sessions per year. And you can have with 2 treatments per week for 6 months, 6 weeks, 6 months, or 3 treatments per week for 4 weeks. If you are in osteoporosis severe, would be useful to go ahead after the end of the protocol with the emitter with others 12 sessions with the MET to cover the part of the body that we didn't treat with the emitter. This study is a study on bone healing delay when we reached an effectiveness of 89%, and I want to show you some cases. This study involved patients with bone healing delay of pseudoarthrosis over 2 years. 2 years is a long time, and we made with this type of patient because the goal was to show what Limfa was happen to make in situation where all other therapies that were available had no success. In this case, case number 1, the patient was male, 42 years old, with pseudoarthrosis at femur, 28 months after acute event. This is the situation at the beginning, this is what happened after only 5 weeks. The situation in terms of osteogenesis completely changed. The protocol that we used was 15 sessions of bone repair program every other day. So 3 times per week for 5 weeks. Case number 10, male, 37 years old, pseudoarthrosis tibia fibula, 9 months after acute event, at the beginning and after 5 weeks. Same things. Same protocol. 3 sessions per week. Here, case number 6, male, 52 years old with femur consolidation. The patient was in a wheelchair. Here after only 5 weeks. But here we have the follow-up after 3 months, because the regeneration of the bone goes ahead after the last treatment. This is the reason for what on osteoporosis or osteopenia we recommend only 1 protocol per year. And to check the result for osteoporosis, of course, if you have REMS, you can check every 6 months, but to have the final result, you have to wait 1 year. This is the indication worldwide for the osteoporosis. Here we have bone biopsy 2 months after extraction. This sample without lymph stimulation, this bone stimulated by lymph. the difference is very clear, because the bone stimulated by Limfa was completely vascularized. This level of vascularization, usually the bone reached after 6 to 8 months. We reached after only 2 months. If you use Limfa, for example, in odontology, dentistry, and after implants, you really could speed up a lot the regeneration process. Here we have another study on osteoarthritis at knee, where only with Limfa we reached an effectiveness of 78%. We are really effective on osteoarthritis at level 1, level 2, or level 3. For level 4, that you maybe understand better, bone and bone, it is better to use Limfa combined with stem cells, because we are a medical research company, we focus on regenerative medicine, and we have different solutions. So we use stem cells too. We use Limfa, that is the core device that is like an app that empowers the effectiveness of other therapies. And when you have bone and bone, you have to use stem cells and after stimulated by Limfa, because Limfa is able to activate stem cells. And on this point, we have another study, very important, that we published in 2024. The study was on cartilage in vitro. We conducted at University of Florence in Italy. Here the goal was to show if our devices was able to stimulate the differentiation. So we started from mesenchymal stem cells. We exposed that mesenchymal stem cells to human cartilage. And we observed some specific chondrogenic markers. Particularly, we observed collagen type 2 and collagen type 1. Collagen type 2, you know, is the good collagen, because ligament, muscles, tendon, cartilage are made by collagen type 2. So the goal here was to try to increase the differentiation. And we increased over 100%. But at the same time, we observed what happened at collagen type 1. Collagen type 1 is the bad tissue, because it's the fibrotic tissue. So the goal was the opposite, to reduce the differentiation, and we decreased over 100%. So what it means, this study? That Limfa is able to accelerate very much the healing process, but at the same time, Limfa is able to stimulate the recovery with a very high quality tissue. And if you use after stem cells, we activate stem cells and we help them to differentiate themselves in the direction that we want. Now I want to show you some case report that show how Limfa is effective on bruises and wounds. Here we have before and after, only one treatment. You can see that we reduce very well the swelling, the color changed very fast. Before and after, observed especially at the forefinger, we reduce very well the swelling and the color completely changed. Here we have ankle sprain. The first photo was European date, so 10 February, 12 February. With only 2 treatments, we reduce in 2 days the circumference of 4 centimeters. That it means that we normalize very fast the patient and we allow physiotherapists to start before with manual therapy. The last case report was beginning of cancren. We started to treat this finger on 1st October, 9 October, 14 October, 21 October and 4 November. Only in 1 month, with only 2 treatments per week, we obtained that result. This was the last slide, but in the last days we made other presentation, and speaking with other people, I said to them that recently we started to work with horses. Horses for race, for jumping, for endurance. And you know that horses don't have a placebo effect. So, or stay well, or stay bad. And I would like to show with you a little video that lasts 1 minute, when you can see a horse in UK, close to Manchester. He was jump horse, and this vet had a diagnosis very bad for him, because he said that he was to put to sleep. So he said, the situation is dramatic, you can try. We started, and this was his story. The name of this horse is Todd. He had bad injury because the diagnosis was both poor and rapid onset, and he had problem at his anterior right leg. You can see it's not fluid. So we started to treat him with a combination of bone repair program and connective tissue repair program only for 3 weeks. And after 3 weeks, the situation was completely changed, only with Limfa, and 3 weeks was not total protocol. So we decided to improve the treatment with a combination of growth factors from blood and stem cells from fat. We made only one injection directly inside the hook of the horse, and after this procedure we stimulated again him for other 4 weeks with Limfa, with a combination of 2 other different programs. And now you will see what happened after only 4 weeks. He jumped. So, the last part of the video, if someone of you is expert of horses, showed that he walked straight forward, and it means that he is really in a good shape. So, this was a very big success for us, and we are happy for him. Now, before to start with the question and answer time, I would like to ask to my colleague Chuck, because I want to introduce again him, because before to start with the project here in US, we tested the device, and we tested how this device was effective if used inside with the OsteoStrong protocol. So Chuck, please Chuck was the manager in Chicago OsteoStrong, and he tested the device for 9 months before to launch in US. So he reached very good result. He collected a lot of feedback from the patients. So he knows very well how you work inside OsteoStrong, and he can describe how Limfa can improve the effectiveness of the protocol of OsteoStrong. And before to start with the questions, we would like to share with you some testimonials from some patients of OsteoStrong Chicago.
I'm Kazmina. I'm the center manager of our Wilmette location. When I started working here, I found out that I had osteopenia. What I got from the Limfa was my chronic low back pain just went away. Having this freedom from the low back pain is incredible. This is the best health I've been in a long time. I started running again. I also started lifting heavy weight. The freedom from that pain has been an incredible.
Hey guys, my name is Harlan. I'm a 13-year-old competitive soccer player. I recently got a really bad leg injury on the side of my thigh. I went out of the game, couldn't play, I missed practices, missed a bunch of other games. I heard of OsteoStrong and I went to Chuck. He hooked me up to this device called the Limfa. First, a little skeptical about it. When I first put it on, I didn't feel like literally anything. I mean, it just strapped my leg. It was like a 70-minute process. Did my math homework. When I woke up the next day, I actually felt like noticeably different. So then I went back for a 70-minute session. By the second day, it actually felt really good. I highly recommend it. I told all my teammates, really recommend it for people that are thinking about it.
I first really got interested in it because of the osteoporosis numbers, healing an Achilles problem right now. So I thought it was kind of a life hack that I could do until I got back to my feet. Well, it was easy, first of all. It was like non-invasive. God, it was like a non-event. I mean, you wear your clothes, it's easy. Easier than I thought it would be, actually. I researched more about it and found out that it could help me with some arthritis. I went to do some serious hand arthritis in my thumb, on bone, and knee arthritis. And I'm impressed to say that I don't have any pain in my thumb anymore, at the base of my thumb, and I have had it for years. I can't believe that, and I'm really thrilled. And the knee arthritis is down by like 70%. It's given me a way that I think I have a scheduled surgery for that thumb in December, and I think I'm going to be canceling it. And you can't put a price on that. So
Hi, this is Mark Lizzie. I'm one of the co-owners of the OsteoStrong Schaumburg and Wilmette in the Chicagoland area. Our real drive to want to acquire it was it had some really good numbers on helping improve bone health and helping to reverse osteoporosis, osteopenia. We thought stacking that with Spectrum would make an awesome combination. Again, that would be very unique, create a very high efficacy. Other reasons why we did like it is it's a 12-week protocol, or it's a 12 treatment protocol. You could come 3 times a week for 4 weeks or twice a week for 6 weeks. The other reason that was important to us was people that would come in for a first appointment would qualify them. They would have some limitations on heavy weights or lifting any weight-bearing type exercise. We've been able to convert them to at least the Limfa program. We also knew the machine had other capabilities. It's really a cellular regeneration platform. Golfer's elbow tendonitis, shoulder pain to elbow pain, even foot pain, or ACL, MCL. We've had nothing but success with every treatment we've done.
I have a chronic condition I've had in my spine since I was 13 after a very bad diving accident that almost broke my neck and back. Causes chronic pain as well as loss of height. Everything I've done at OsteoStrong has helped this. The Limfa bone protocol very rapidly helped with the pain issues, which has helped so profoundly. I've had 3 spinal fractures in the last 5 years. They were compression fractures. I've lost about 1.5 inches of height, and there is very severe pain in those areas. The Limfa helped that in such a way that in an overall sense of being more robust, is really uncanny, to be honest, in a 6-week period. It's worth the investment financially and time-wise for the overall quality of life that I'm experiencing.
As a manager, it's been so seamless to integrate. I've started using it in my first-time consultation as an offering. So some of our members aren't able to do the Spectrum, so they do the modalities, but now it's amazing to have this other offering that is actually helping their osteopenia, osteoporosis. It's been incredible to witness and is rewarding. Everyone that's done it has had their own success story. So just hearing that and witnessing it is amazing. Like the transformations people are getting. We hear so many different stories. It works, it's easy. I can't say enough good things about it.
Thank you very much.
Yeah, thank you. Thank you guys, and now we'll open it up for questions. Yeah?
Who determines the treatment that's being used? Like when you go for physical therapy, you get a script from the orthopedic doctor that says work on this, and this.
The way to do that is to have a diagnosis from your doctor. People will usually know, I have osteoarthritis in my knee, and if we have an accurate diagnosis, it's as simple as selecting the appropriate protocol.
And who does the selection? Is it
OsteoStrong, but I mean, if you have osteoarthritis in your knee, we use the osteoarthritis in the knee protocol. It's that simple. Like a child could choose it if you have a correct diagnosis.
okay, so like arthritis in your hip joint and
Yes.
plus osteoporosis, it would be the same treatment, just
2 separate treatments. So there's a protocol for osteoporosis, and then there's a protocol for osteoarthritis in the hip.
So it would be two different sessions.
Yeah, 2
Yes.
different packages, and you would ideally do them one after the other in succession. So if you have 5 conditions, or you just pick which one is the worst, which one you want to work on the most, and then go in with triage, self-triage, I suppose.
Consider that for every pathology we validated the protocol. The device is completely automatic. So to select the program, it is very easy because not needed operator. But as Chuck said, it is important to follow the priority, because if you treat 2 different things at the same moment, you could create confusion to cells. So follow priority, but for every different needs, we have different protocol.
So the device was developed in 2011. The first 7 years was all clinical and research, and then since then it's been used in the field. During that time, the 7 years of clinical development is when they developed the protocols and validated them through experience with thousands of patients.
We are medical device class 2. We have solid science, we have certification for FDA, US, MHRA, UK, we have for Saudi Arabia, we have for Israel, we have for Malaysia, for China, and for Europe, of course. So on field at the moment we have more than 500 centers. Yes, please.
So,
Oh, you're next, sorry. She was
Okay, no
she was in
problem.
line.
yeah, no problem.
So apparently the recommended treatment is 2 to 3 times a week for different modalities. What if you're not able to do you get any benefit if you only can do it once a week?
You have to follow the protocol as it's, you have to follow the protocol as it's recommended in order to run that.
Consider that if you have to treat the symptoms, the inflammation, the edema, or the pain, you could have some result after 1, 2, 3 treatments. But if you have to treat tissue repair or chronic pathologies, you have to follow a protocol. And it is not important only the number of the sessions, but it's important for how long time you stimulate the tissues. Every tissue is different. For example, muscles are enough 2 or 3 weeks, but for tendon, ligament, and bone, you have to stimulate for at least 5 weeks. For this, our recommendation is to have a treatment not every day, but every other day, or twice per week. Only one stimulation per week is not enough.
Yes, miss?
So when you said the stem cell, my ears perked up. I had stem cell injections in my knees in May last year.
Okay.
So is there a timeline? I have osteoarthritis in both my knees, bone on bone with bone spurs.
Okay.
I have degenerative disc disease in my back, and I also have bone spurs in my shoulder, all due to arthritis. So does that give me a little bit of a benefit?
I reply what?
Rheumatoid?
Different
No,
different questions.
osteoarthritis.
For osteoarthritis, we are really effective. But osteoarthritis have different levels.
Yeah,
So we have to check in which level you are. Because if you are
mine's pretty bad.
number 1, number 2, number 3,
Yeah,
only lymphoid is enough.
okay.
If you are in bone and bone, and you already made stem cells, so maybe you are in that level.
Yeah, I just wondered if there was a timeline for the
Yes,
effectiveness
2
of the
weeks.
stem
Yes,
cells.
Yes. So to stimulate stem cells is something that we should make immediately after injection.
Okay,
Consider that with ligament and tendon, if we wait more than 2 or 3 weeks, it's too late. For bone is different. For bone we could stimulate after more time.
Mhm.
But in May is 10 months, 9 months is too much time.
I know they said it could be effective for up to a year,
Yes, but the
but
fact
I
is,
just
at
wondered.
the beginning, stem cells are like neutral cells. So the point is that doctors put stem cells in a specific joint because they can change their self. In your case,
Mhm.
the opening is versus cartilage.
Mhm.
But after 9 months, they made the big part of the trip.
Mhm.
So it's too late for stimulate.
Yeah.
But you could try Limfa to manage the symptoms. If you have some symptoms in terms of pain or reduction of mobility, you can try if you can have some benefit without stem cells again.
Sure.
For other things that you describe, for example for discus,
Mhm.
to treat discus you have to undergo to surgery because it's something that is not possible to treat without surgery. But we have a specific protocol because our goal is not to work on discus, but to work on the tissues that are around disc. So if we work on this, we can reduce the swelling, reduce the inflammation, and the consequence is that we will reduce the pressure on the disc, and you will feel better in terms of pain relief and increasing of mobility. So you can try this protocol. The last was shoulder, but I don't understand which level of osteoarthritis you have.
Yeah, that one, I've been x-rayed. I know there's bone spurs, so you know when there's bone spurs, it's
Okay.
pretty, the body has tried and can't regenerate.
Of course, was the situation of the horse.
Yeah.
We
It's,
treat you in a situation like this.
yeah, I did have nerve entrapment there, but I did some intense physical therapy and I don't have that anymore, but it still is an issue, there's still pain.
Consider that shoulder is a very complex joint.
Yeah.
So maybe we are not able to work directly on the bone, but with our approach, our field is 18 centimeter. Maybe we can help better on soft tissue.
Sure.
So on the bone, the situation will remain the same, but working on other tissue, we can give you some.
Sure,
Functionality would improve.
Exactly.
yeah,
And I wanted to add with the bone on bone, the lady that said she thought she might cancel a surgery because she was bone on, so she did exactly what she went and got stem cells. First, we were just working on her knee and we have an extra emitter and she's like, oh, my hand feels so much better. I'm like, yeah, but if you wanted to keep that, you have to get stem cells because we can only reduce the bone on bone. If there's no cartilage there, we can't repair
yeah,
it.
there's no cartilage.
So,
I know
but-
that for sure.
If you get stem cells, and she got stem cells and then we did the protocol, she was able to cancel the surgery and she's still, I just talked to her the other day, she's still doing well.
Maybe she will go under surgery in the future. But
Perhaps.
the goal
Yeah.
would be try to cancel or to postpone.
Sure,
Especially for young people,
Yeah.
50, 55, 60,
yeah,
that are young, I'm
Yeah.
50. Yes, to undergo to surgery for implants is to help it. So it would be very important to be able to postpone surgery, and
Sure.
Limfa is very effective on this.
So you can get more injections in your knees and then do Limfa right afterward and then we can repair.
yeah, it's just, it's really expensive.
Yeah.
And I
Come
did
in
it, it
Italy.
didn't
Come in
really
Italy, it's
produce
cheaper.
any results.
What do you say? Really
I'm
expensive
going to
and-
Italy in August, actually.
Yeah, really expensive and what?
And I got no results.
Yeah, so, yeah.
They followed up with PRP twice.
Okay,
Yes,
But
but
I'm,
that's not
two
regenerative.
different
Yeah.
things.
Yeah.
First, stem cells, the word, we know very well stem cells because really we are in the company of stem cells. All the stem cells kit are not the same because there are stem cells that are not stem cells. They use for health, for aesthetic, for other things.
Mhm.
Or now I don't know which kit you used, but I don't want to speak about kit. But it is important to understand which type of stem cell you are using because
Yeah.
the result will change a lot.
sure, yeah.
With
It
PRP,
wasn't my own because I'm 66, so they used umbilical cord.
Yeah, mesenchymal stem
Yeah.
cells, yeah.
Okay.
And it's
Yes,
from a
but-
very reputable lab.
Yes,
So-
but
I-
mesenchymal stem cells is like to say that all the therapies use magnetic fields. I tried today to explain that we use magnetic fields, but we are really different from the others.
Fresh or frozen umbilical cord?
Fresh.
No,
No,
okay,
it's
I
fresh.
mean, but there's,
Yeah.
and there's
No, of
10 other
course.
questions.
Yeah, sure.
You know, with.
Yes, but
Yeah.
I want to conclude this
Yeah.
thing. And because I'm Italian, so to explain in English is a little bit complicated. So. And the point is that stem cells work in a different way.
Mhm.
So if your goal is to regenerate the tissue, you have to use specific cells
Mhm.
that are pure.
Right.
So in what they inject, they have to separate blood and other elements like oil, because if they inject oil and blood, they produce inflammation. So you should use a kit that is able to have really a concentration of stem cells.
Mhm.
And if your problem is to regenerate, the dimension of stem cells would be specifically between 600 and 800 micron. And these things many doctors don't know. Okay. To use PRP is, like said, is for different aim, for different scope. Because with PRP you can reduce inflammation.
Mhm.
But if the scope is to regenerate, you have to use stem cells. Using together could be useful because with PRP you reduce inflammation, with other products you stimulate regeneration, and with both you can use it. Come in August, make in Italy stem cells.
Yes.
Now, since you have been around since 2011, what's your long-term outcomes from these protocols? Do they last? Do you have to have them redone? What is the long-term coming?
Depends on the pathologist, okay?
Okay.
Because nothing is for all the life.
Right,
Okay?
right.
So you have to take care of yourself. I think that you come here every week
Makes
for
sense.
this reason. But for osteoporosis, we show during many years of science that one protocol it is enough.
Mm-hmm.
We recommend for year. We recommend to have a second protocol with the MET only if your level of osteoporosis is severe. So if you will have result, you should repeat every year one protocol. For other pathologies where are involved symptoms, fibromyalgia too, you have to follow what you feel. There are patients for who is enough one protocol per year, others when you have to repeat every 6 months. For our experience, we never made more than 2 protocols per year for every patient.
Is there any problems with mast cell activation syndrome?
No.
With this, there's, because it takes the inflammation down.
No.
Yeah, we've
So,
had
no
zero
problem.
It
reports.
doesn't irritate, I know sometimes things get better before they get, or get worse before they get better, so that makes perfect sense, because you're irritating. But you're also on the cellular level, you're trying to take those cells out of danger response and bring them into a more cohesive kind of talking together. Sometimes mast cell people get more stimulated than other people.
Mhm.
Have you seen any problems with mast
No,
cell
no.
people?
Yeah,
No
the
problem.
Good.
only thing is what he mentioned, that in a chronic pathology, sometimes when you first start the symptomatic programs, as the area wakes up,
Yeah.
you can experience a little
worse.
more pain.
Yeah.
Usually it's not too bad, and like you said, it only lasts maybe two treatments, and then we're actually starting to treat the underlying edema and inflammation, and the pain subsides. And then with all the things, you have to consider, with osteoporosis, after 40, we're losing bone at 1% a year on average. So you get to keep what you build, like it's not just gonna disappear because you stopped receiving treatment, but you'll lose it at the same rate that you were previously losing it. And with fibromyalgia or rheumatoid arthritis, the severity of your underlying, what do you call it, autoimmune dysfunction will be the factor that determines how long you're able to achieve relief of symptoms. Does that make sense?
Does hormone replacement therapy play any key with this?
In what sense?
In the sense that the progesterone is supposed to help with bone density?
Oh, I mean, yeah, like.
Does that enhance anything, or you guys haven't seen any change?
No problem. We can work with other approach for bone density.
It's almost like a separate thing, basically.
Yeah,
so
but it actually would, maybe it would work together, you know?
Yes,
No,
they are
totally.
synergic.
To enhance
They are
it.
Yes,
synergic.
yes.
That's what
yes.
I'm saying, it would
Yeah.
help to enhance it.
But just like, I mean, we don't have specific research on Limfa and spectrum yet, but there is research on magnetotherapy and exercise showing that they work better to increase osteogenesis than either does alone. So, and same thing, like if you're taking supplements and you do the bone health protocol, it'll be good to have the building materials there because the cells will be stimulated and hungry. So yes, all of that stuff would be synergistic. You know, you can support it in any way that you can support the normal functioning of your cells. Limfa is just going to increase the effectiveness of all of that.
Well, the more better it communicates, the better the treatment, so
Precisely.
that makes sense.
Yeah.
So,
All right. Oh wow, 3 at
Many
once.
answers.
All right, she hasn't asked one yet. In the back.
Does Limfa help anybody with herniated disc or bulging disc?
yes, it's
Yeah.
what I said to her. We can't work directly on disc because to work on disc you have to undergo to surgery, but we can work on the tissue that are round. So reducing swelling, reducing inflammation, we can reduce the pressure on the disc, and you feel better and increase your mobility.
There's a protocol for it.
That's I guess
So
what I wanted to
it's-
ask.
if
Is
you
there a
look for-
protocol for that?
Column stenosis and hernia and/or hernia post-surgery. So that protocol covers all of those indications. Yeah. And then, yeah, you had a question?
So,
Oh, sorry, go ahead. No, go ahead.
You can go and then.
Okay, so a question of degenerative disc disease. So, the discs sort of dehydrate, and sometimes nerves decide to join the party.
Mhm.
Does this enhance and get rid of that nerve pain, and does it regenerate the disc?
It's case by case, but we can't work directly on the discs,
Right.
even in the degenerate, so that we don't regenerate discs. But we can help to reduce the inflammation and other things around, symptomology in the tissues surrounding.
Mhm.
And then we can help to repair the muscles and nerves as well.
Okay, and on that note, if the doctors think it's something stemming, no pun intended, from the spine, but I have a nerve entrapment in my thigh that's been going on for 3 months now, and they're insisting that I keep doing this physical therapy, it's gotten better, but I feel like I'm at the end of the road for that working. Does this regenerate the nerves? Does it wake them up and say, hey, you guys have been misbehaving, cut it out?
But your problem comes from the inflammation. It's not the nerve. So the point is that to reduce inflammation can help the nerves. For the other thing, what we can do as
Do you treat the thigh or the back?
sorry,
Do you treat the thigh where the nerve is entrapped?
the back, because the nerve that you have starts from a compression that you have here. So
Okay.
we have work here.
So they call
It's lumbosciatalgia. It's a program for lumbosciatalgia that we have.
We would say lumbosciaticalgia. So that's what that is sciatic or other nerve entrapment caused by compression in the lumbar or sacral area of the spine. Does that make sense? Yeah. Cool. Any?
Okay, I'm diagnosed Lyme for 10 years. It ate my joints. Knee replacement 7 years ago. Inflammation hasn't gone down. Now it's run into my ankle. Since it's a replacement joint, you're going to work on the tissues around
Precisely.
and get the fluid moving and
This is one of the things that Limfa is able to achieve very quickly is a reduction in edema and inflammation.
okay.
And so that would, we would work on that, and that would reduce the other problems that are the pain that is associated with it.
But we should have a diagnosis.
Well, there's a diagnosis, yeah.
Because yes, we can work on the effect, but the value of Limfa is work on what produce the effect. So
Yeah,
if
but
you
there's
want to
no-
reach the maximum that you can from the device,
Right.
we should investigate about what produced that.
Yeah, the Lyme's did,
Lyme
but there's
disease.
Lyme disease. There's no infection now, but it's not.
Yeah.
Get
I-
it.
I-
We can
I-
work on this.
Okay.
Yeah. Okay, yes, ma'am.
Is any of this anywhere ever covered under insurance,
No.
health insurance? Like, not even in Europe or anywhere?
No, because it's new technologies. New technologies
Yeah.
need time.
And it works.
It's the same in Italy, it needs time. Consider that we speak with many doctors every day, every week, and our approach is based on demonstration. So our product specialists in Italy are or biologists or biomedical engineers. So they visit the doctor, they say, okay, next week you plan to have some surgeries, okay. For the first week we will treat them to show you what happened, but we have to repeat this approach with all the doctors. So there is no way to inform all in one time, so we need some years. But in the meantime, all the centers that use the Limfa, they use in private, and they work very, very well.
Yes, ma'am?
If a physical therapist has the equipment and your
Yes.
insurance covers the physical therapy.
No,
They
there
don't.
is no specific
CPT code.
yes, the code,
Yeah.
but all the therapies that use magnetic field are covered under the umbrella of magnetic fields. So they will have reimbursement from this, but they don't use a lot because this device is really new, it's really effective. So they don't like to propose like something that produces reimbursement, but they propose for private.
Does age get in the way of the success of treatment, like the older you get? And obviously your body is as well. Does age factor into that?
No. We had result with people very old, and in the group in the study that we did, we involved people with
Yeah, we had this
aging.
successful case with an 86-year-old lady, very sweet lady. She only had osteopenia in her 80s, but then she had like a C. difficile, a really bad GI infection, started rapidly losing bone, came to OsteoStrong. After a year, we had slowed her rate of loss. She was actually my first Limfa member, and 6 months passed. We were just excited. We wanted to see what we got so far. Now, because we didn't get the same results that other people may get, but she had been consistently losing for 4 years. One vertebra stayed the same, the other 3 improved, both hips improved. She was crying. So I mean, that's yeah.
I'd be celebrating.
We sat in the little room right there, and we were hugging, because this
Wow.
is something we've been working on for 3 years to try and slow this down, and this helped us turn the corner, and now we're building, so,
That's great.
yeah.
What can change are the timing to reaction, because young people react very
That's
fast
right.
compared to old people. But at the end, maybe you need some treatment more. But the effectiveness risk on old people too.
Have you used this or researched this at all for cancer treatment?
Cancer is actually one of the contraindications right now because we have not researched it. Not because it's bad for cancer, but just in the research that they didn't include those populations.
Okay.
Yes, but on human no, only in vitro, because we research every year and we develop new sequences that we use in vitro on 3 different line of cancers, and we obtain very good results. So we are pending for the new patent for these sequences. We obtained last October the approval. We didn't publish the study because to have a patent we can't publish before to have a patent that we will have officially at the beginning of 2027. But that show you that this approach, this type of technology could help this type of pathology, but the process to arrive to use on human in vivo is very long.
Yeah.
Maybe in the future.
Maybe.
Yeah.
Yes.
I imagine it would help scoliosis as well. My son's got a compound rotatory scoliosis where his rib cage touches his hip. It's that bad. So he's in chronic pain.
So it's outside of the indication for Limfa.
Mm.
You could use the symptomatic control programs to reduce the inflammation.
I would think it would help his pain.
It should help his pain. It's just outside of the scope, so
Yeah,
we don't
I
have a
get it.
protocol for it.
Okay.
Yeah.
You said scoliosis?
Yeah.
Scoliosis, it is impossible to treat without surgery.
Without.
With physical therapies, it is impossible.
Yeah.
But we can manage the effects that
Yeah.
scoliosis produce.
Yeah.
That we can. This we can.
Maybe check the most effective. You've heard of Scroff therapy?
No.
Okay. Well, just remember to ask me again before we go, because it's a German therapy. That's, if there's anything that can help, that's it.
Mhm. Thank you.
Mm-hmm. Next, any other questions so far?
Next question will a trip to Italy.
Yeah.
I'm joking, guys, not true.
Yeah.
When are you gonna be public?
Oh, when's our IPO?
Yeah,
We'll a few years out.
you got more research to do.
Yeah, we got, all right, well, if we don't have any more questions, is there anybody that's interested in learning about scheduling, pricing, availability? Does anyone think this might be able to help them?
Mhm.
Yeah? Okay, so